The global health landscape shows that over 700 million people live in extreme poverty, facing poor health outcomes. Health is a fundamental human right, but poverty creates significant access barriers. The burden of disease is much higher in low-income countries, and addressing these health inequities is crucial for achieving the UN Sustainable Development Goals, especially 3 Sudanese pounds. Health and economic development are fundamentally linked. Poor health reduces productivity and educational attainment. Addressing health disparities is essential for greater societal well-being and economic stability. Health disparities are preventable differences in health status and access to healthcare among different population groups. These differences are often influenced by socioeconomic status, gender, location, education, and access to services. For example, rural areas often have limited healthcare access compared to urban centers. Determinants of health disparities include socioeconomic factors like income inequality and unemployment. Geographical location also plays a role, as rural areas often lack facilities. Gender and ethnicity can lead to discriminatory policies. Finally, weak political and policy frameworks result in poor public health outcomes. Health disparities impact the poor through higher rates of maternal and child mortality, increased prevalence of communicable and non-communicable diseases, and limited access to vaccines, medications, and preventative health care. The WHO's Health for All vision aims for universal health coverage, ensuring essential healthcare services without financial hardship. This promotes equity in access, affordability, and quality. However, barriers include insufficient healthcare infrastructure, a limited workforce in developing countries, and economic instability. Successful global models include Thailand's Universal Coverage Scheme, which provides affordable healthcare, and Brazil's Unified Health System, which focuses on comprehensive, decentralized primary healthcare. Poverty leads to a higher disease burden, with communicable diseases like tuberculosis and HIV/AIDS disproportionately affecting low-income populations. Non-communicable diseases are also increasing. Barriers to healthcare access include high treatment costs, lack of trained providers, and transportation issues. Malnutrition and hunger significantly impact health. Undernutrition contributes to child mortality and weakened immune systems. Micronutrient deficiencies lead to cognitive impairments. Food insecurity is a major challenge, especially in sub-Saharan Africa and South Asia. Strategies to improve the health of the poor include strengthening primary healthcare systems through investment in rural health centers and training community health workers. Making medications affordable and accessible through generic drug promotion and subsidized programs is also essential. Key public health interventions include mass deworming campaigns, family planning programs to reduce maternal mortality, and safe water and sanitation initiatives to prevent waterborne diseases. A successful community health case study is Nepal's Makwanpur district. Participatory learning and action groups educated women on pregnancy and newborn health, using simple, low-cost interventions. This resulted in a 30% reduction in neonatal mortality and enhanced community participation. Education is crucial for health improvement. Health literacy is enhanced through community education on hygiene and disease prevention. Women's empowerment and education lead to better healthcare-seeking behaviors and improved long-term family health. Addressing malnutrition involves tackling the global challenge of wasting and hidden hunger. Global initiatives include UNICEF's ready-to-use therapeutic food programs and the Bill and Melinda Gates Foundation's investment in biofortified crops. Neglected tropical diseases, such as river blindness and schistosomiasis, disproportionately affect the poor. A success story is the Carter Center's guinea worm eradication campaign, which reduced cases drastically. Policy and funding are vital for health equity. Sustainable healthcare financing requires long-term public health investments in the expansion of national health insurance schemes. International efforts must ensure transparency to prevent corruption in spending. We must call to action by investing in research and innovation and advocating for equitable health policies. This marks the end of this video. Thank you for viewing. Thank you.